Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is
A Podful of Pediatrics.
Subscribe here for more content.
Or go to onecommunityhealth.org.
Or follow us on social media at One Community Gorge. So this is the one where we talk about
chest pain and fainting.
So if you were not talking about pediatric patients, this would be a really intense and sad podcast.
But it's not.
It's not.
It's pediatrics.
So thankfully, in kids, chest pain and fainting are not usually related to serious medical issues or even to their hearts.
Right, which is really good. Although we do get this a lot. And
Questions
we do
about this.
And we do take
Not
it
chest
seriously.
pain,
Right.
personally.
Oh, yes, true. Yeah, we get questions about this and have people come in questioning their own chest pain as children. And we still take it seriously because it is important to take seriously. It's just that luckily most of it is not medically concerning.
Right. And just to clarify today, we're only going to talk about non-traumatic causes of chest pain here.
So you have to go to the pit and look at that if you want like traumatic
chest pain stories, because that's like an emergency room conversation. This is a primary care physician conversation. So
that's right.
Some of the most common causes we see for chest pain, the number one on the list is Dr. Hankins' favorite topic.
It is asthma.
Yes.
But we're not going to talk about that in this episode.
I'm going to save that. It needs this whole episode by itself.
I made it a whole...
Because she loves it so much.
Whole episode all on its own.
So that is a cause of chest pain, but it's going to have some wheezing and coughing with it, so it's not going to be chest pain just by itself.
That's right. So instead, our first one we're going to talk about is GERD, or gastroesophageal reflux disease.
Which is really common in all humans, particularly kids.
And if you remember back to our newborn episode, we said lots of babies have reflux. In fact, all babies have reflux. This is kind of what we're talking about. Not all babies have GERD, or like the disease portion of it, but all of them have reflux. It just typically isn't painful for little babies.
And, it's harder to pin down in kids because they don't say your classic symptoms. And sometimes they'll literally say, my heart hurts.
Yeah, or they'll come in with chest pain and type things, and then I'll be like, oh, does food ever come back up into your mouth? And they're like, yeah.
And the parents are so shocked when you say, do you swallow it back down? They're like, yeah. And you're like, what? But it's pretty common. And, kind of how kids work, if it's something they've always done, it's not weird to them. So why would they say that it was happening, right? It's always happened.
And that's true. And sometimes they will describe it as actual chest pain that's hot or burning. But a lot of times they'll just kind of say they have chest pain.
Yeah. And timing is often a clue because it usually occurs after meals, like if they ate too fast, ate too much, or they go and lay down too quickly.
It can happen with sleep, or it can even awaken them from sleep, like especially if they ate late. Sometimes they'll have reflux that kind of wakes them up.
Yeah. And then emotional stress, that makes everybody reflux more. It makes more acid in your stomach.
The treatment can consist of lots of different things, but there are even some behavioral changes, like don't eat a lot, quickly right before bed. Definitely don't eat spicy foods before bed.
Right. Limit your tomato. And tomato-based stuff is pizza and spaghetti, right? So you're trying to limit that before bed.
How about no Takis?
No Takis ever. How many kids we've seen with terrible reflux and even ulcers from Takis?
Yes.
So try to avoid those. Yeah. And then I always recommend that you raise the head of the bed, and not with like a pillow or under the mattress, like literally a block of wood or an old textbook, because we don't use those anymore, about 2 inches from the floor, so your head's slightly higher in your stomach, so gravity literally keeps stuff in your stomach better.
And then at night, we also avoid mint flavors like gum and carbonated beverages.
Yes. And if these changes don't help, we sometimes consider medication. Like an H2 blocker, Pepsid, is over the counter for adults, and they actually make a liquid version for kids because it's super safe and helps decrease some of the acidity. Sometimes
a little bit of a Tums, like half a Tums, can actually be helpful both for diagnosis and treatment. So sometimes you're not sure, like they come in and it's kind of like, I think it's reflux based on timing, on exam, where they say it hurts, all that kind of stuff. How about the next time you have it, try a half a Tums, see if it helps. And if it does, and they really have infrequent episodes, that can actually be a treatment in and of itself.
Yeah. But if reflux is lasting for a long time, for like years, then they really do need evaluation, because sometimes it's a little bit more complicated than just straight GERD.
And it can cause long-term complications if it goes on without ever being kind of researched or kind of looked into.
So another common cause of chest pain is costochondritis, which is mostly in like school age years, and it's basically inflammation of the cartilage between the ribs.
And it is associated with tenderness where the ribs kind of join the sternum or the breastbone. We will actually be able to like touch it and they're like, ow.
That hurts right there. And it's usually asymmetric with actually the left side being more frequently affected than the right side, which again makes people worry about the kid's heart because it's right over their heart. But if it's touching when you hurt it, it's not their heart.
And then, like I said, you can sometimes do a physical exam where you can kind of feel it. You can also reproduce the discomfort, like either holding on the armchair side or doing the
Crowing rooster maneuver,
maneuver,
which, we don't really do, but now I'm going to because it's fun to do.
I have never even heard of, but I'm going to try it next time.
Yes, exactly, because that would hurt to move your arm if your chest hurt,
That's true. What a great thing.
So
we always learn something in
We
these
do learn
episodes.
something when we do this. So the cause is usually unknown, but sometimes we kind of go, oh, were you hanging on the monkey bars a lot?
Or coughing because you were sick recently. Those can be common ones that'll do it.
And the treatment is rest, ibuprofen, and improved hydration, as is often the case for most of the kids' issues, right?
Yeah, you're going to hear that a lot in this
Yes.
episode. Rest, hydration.
See, precordial catch, which is another super fun name, known as the Texidor twinge. It sounds, it sounds like a line dance.
Yeah.
Like the Texidor twinge. It's another benign cause of chest pain in kids. And this is like super sharp, brief episodes that you get in your chest that I remember having as a kid. And all of a sudden you're just like, oh, what is that? And you actually can touch where it is and it makes it feel better to hold it.
Yeah, and it's basically one inner space at the left side of the chest, and so it's pretty, again, where you would expect chest pain to be, and it is typically at rest or with mild activity.
Yeah, and it feels a lot like a stitch in your side, where you're just like, oh, it's twitching and hurting at the same time.
Yeah, and it's often like when you're kind of breathing in, so like it's that kind of painful, fast, like right as you breathe in, and that can be really scary to kids.
But it comes and goes usually for a few weeks, and then it'll be gone, and it goes away with rest. Prehydration helps prevent the pain because it usually is kind of like almost a muscle overuse at that part of the chest.
And then the next one is another odd but great name, Tetzy syndrome.
Yes, and it's a benign, painful, localized swelling based in the same places we're talking about, like between the breastbone
Joints.
and the rib, or where the ribs kind of hit each other, or the sternum.
And only one area is usually involved, and there's actually not just, they cannot only just tell you that it hurts there, but there actually might be a little bit of swelling there as well.
And that's how it's different from the costochondritis, is like you can actually see that it looks a little swollen there.
It is pretty rare, and it is we don't really know what causes it, but often is usually associated with they've been coughing a lot, whether that's from an illness or pneumonia or asthma, whatever.
And pneumonia is another cause of chest pain, but again, like we talked about with asthma, there's going to be some coughing involved. It's not going to just be a random chest pain.
Right, and they are going to act sick. Like pneumonia, kids act sick. Like you don't get pneumonia out of nowhere. Like there'll usually be an illness leading up to it. They often will have fever. They'll often be breathing faster, working harder. And they'll have chest pain with that.
And we usually diagnose pneumonia by listening to the kid's chest, but
sometimes we do an X-ray.
Sometimes we do an X-ray if we're not sure, but pneumonia has a specific sound that you can hear.
I know, and see, she doesn't like the sound, but basically you can just take your hair and put it right by your ear, and you rub the hair together, and that is exactly how it sounds in your lung when you
I think it sounds like a wrapper being open, because my hair does not really make sound by my ear.
She has really good hair, but mine
just not
rubs
very
together
loud.
and it has little tiny crackles, and that's actually what we identify as pneumonia, is these tiny little crackles that you get on inspiration and expiration in the lungs. And those, if you hear those, most doctors will be like, yep, that's pneumonia. And interestingly, basically what that means is there's fluid that's in that space within the lungs, and when you breathe in and breathe out, that fluid moves, and that fluid is actually what's causing the pain. It's there are
It's not meant to
pain
be
receptors,
there.
right? There's pain receptors in our lungs like other places, and when that fluid swells out, it hits those, and that's what causes the pain.
Because fluid is in motion.
That's right.
That's the story.
Yeah.
Treatment is usually antibiotics and, of course, fluids
And rest.
Okay. Fluoridynia, another fun word.
It is. This is like a ton of fun words.
I know. I never thought chest pain would be this great.
You know, this is kind of why I love the chest and lungs, because not only is it really fun, but they have so many great words.
You know what? I think skin has a lot of fun words, too.
No, not even. We even talked about that. That is not as fun words.
Fluoridynia is an acute illness with really painful spasms of the muscles in the chest and sometimes the abdomen too. And it's often associated with a fever and a virus.
Yeah, and it most commonly occurs with a specific type of viruses called Coxsackie viruses. The Coxsackie viruses are actually what causes hand, foot, and mouth disease. So that's where you have the little ulcerations or blisters on your hands inside your mouth.
And you get these like just sharp pains, like spasms, like you would have like in a muscle in your chest. And kids will really cry and say their chest hurts, which is a little bit confusing because you're like, wait, you have sores in your mouth and hands. Why is your chest hurt? But it is association with the virus.
And treatment again,
Rest.
ibuprofen, rest, hydration. We are something so repetitive.
We are. This is kind of how chest pain goes. A really common cause of chest pain for kids, actually 1/3 of the causes, is anxiety.
So, and we did a whole episode on this, so we're not going to dive deep into anxiety again, because it took us a really long time the first time. Yeah. But it makes sense, right? If there's been stressful events, recent death, illness, accident, family separations, children can have anxiety. And when they often have anxiety, they do get anxious. They breathe faster, their heart races a little bit, and that often will come with a little chest pain.
And how we differentiate this is often there's another thing happening too, right? The sleep's messed up, they're having headaches, they're having leg pain, they're having
abdominal pain,
belly pains.
Yeah.
And so, it's something that chest pain, we always want to think about the whole picture and not just so hyper focus on the one part of their body.
Yeah. And that's the important part about this one is that if they are having chest pain, but they don't look sick, they don't have a fever, they're not short of breath, they don't seem dizzy, they don't require emergency evaluation. And especially if they're having these other events in their life, this could be anxiety. Keep them calm, distract them. Yeah. The sensory box, which we talked about with anxiety.
Exactly, yeah. I mean, when kids are having a moment of intense chest pain and they haven't been sick, just get their mind somewhere else, something that makes them feel safe and feel happy.
Yeah. Have them eat or drink something. You can also try a dose of ibuprofen or Tums, like we said, because that might help one of the other two things.
Exactly.
Because interestingly enough, reflux gets way worse with anxiety.
It absolutely does. And what the kids don't need you to do is freak out. So when your kid is having chest pain, if you look terrified, well, then they're more terrified, right? And their pain hurts more. So you just really want to be calmly, let's try a drink. Let's try a Tums. Something else to kind of figure out what's happening.
And if they are still not improving, if you have these things that are continuing, absolutely bring them to see us. And you know what? We're going to worry about the things that are red flags too. We're going to try to rule all of those out. So there are some things that we do worry about with chest pain. And these are the ones we're going to talk about next.
Yeah.
The majority, all the ones we talked about above, are ones that we can treat fairly easily.
And are the more common ones.
And are way more common.
Yeah.
These are the ones we worry about though. And they're conditions like myocarditis or an inflammation of the heart muscle itself.
Spontaneous pneumothorax, which is basically a hole in the wall of your lung.
Yeah, and it fills with air instead of, which is not supposed to be there.
And it hurts really bad, but it comes on super fast.
Pulmonary embolism, where you actually have a clot in the lung, and that's really, really, really uncommon in children.
Yes. And inherited heart disease, which most of the time you're going to have some family history about that to give you a clue.
So what are our red flags that we really want you to worry about? Are fainting or dizziness with exertion. So if your kid is exercising and they are feeling really faint and dizzy, that actually really, especially with chest pain,
having chest pain, yeah,
that is a worry to us. And those often indicate those heart things that we worry about, either problems in the coronary arteries that kind of feed the heart,
or the heart muscle.
The heart muscle itself is big, like your hypertrophic cardiomyopathy. That's kind of what we worry about in athletes that have problems with their heart suddenly. And so if you're having those things, that actually does need to get checked out right away.
For sure. Palpitations, which is heart beating fast, and kids will often say, my heart is beating out of my chest. If that's happening with activity, then we need to make sure it's not an arrhythmia, right? That their heartbeat is not going too fast or too irregular.
Saying that, kids who run a lot, their heart will beat faster.
Yeah.
And it's supposed to. That's putting all the muscles, or putting all the flow where it's supposed to go to your muscles. But at the same time, if they're feeling like it's really out of the ordinary, that's when we want to see it and we want to check it out. And you can actually check your own child's heart too. It's actually not that hard.
Right. Do you listen for 6 seconds and you just times it by 10, and you can look it up online based on their age, what the expected heart rate would be.
Right. And even their expected heart rate with exercise.
Exactly. Because they can get pretty fast, and that's how it's supposed to be.
That's right.
Obviously, chest pain with difficulty breathing, we talked about, is a concern. Fever and chest pain is a concern.
And then heart failure symptoms are things like shortness of breath on exertion. So all of a sudden they're running or playing or even walking up a hill and they're like really short of breath, or they have increased work of breathing, like again sucking in between your
and no history
breaths.
of asthma. You're like, what's
Maybe
happening with your heart muscle
That's right.
there? So we talked about evaluation for chest pain. Of course, the physical exam. Please see your provider, right? If your kid is having chest pain frequently.
They do need to do a full exam, like kind of checking heart and lungs and skin and all of that. And then often providers will do x-rays and EKGs. EKGs is easy to do in the office, and it'll check and screen for a lot of the really bad things.
Yeah. And occasionally we'll refer to cardiology if there are some concerning history of physical findings, but it's not very common.
Yeah. And so then that brings us to the next topic
unrelated, but also similar topic. Fainting.
Yes, and we do get it a lot in similar visits.
And it's similar because it can be really scary, but the vast majority of the time, it's not caused by a serious underlying problem.
And the medical term we use for fainting is syncope.
Yes.
And that feeling that you get before fainting is called pre-syncopal, kind of the pre-fainting.
Yeah, exactly. You're like, it's coming. And syncope, by definition, is a sudden, brief loss of consciousness associated with a loss of tone, but which you recover spontaneously, right? So it has to have all those parts where you're like, get knocked out, you fall down, but then you kind of come around yourself.
And then up to 15% of children experience a syncopal episode prior to adolescence. And we think that number is higher during adolescence. And then in certain situations, like, hey, I'm going to have a performance. I'm going to give a speech. I'm going to have those things. Those are things that tend to cause more pre-syncopal or syncopal episodes.
And again, most causes of syncope in kids are benign. They didn't drink enough. They didn't eat enough.
They got scared or surprised. Like, think frog dissection in biology.
Right, they're all falling like flies, right?
That's right.
Yes.
This is a big one. Or actually, some people really do have a response to blood, right? Like, so they see blood for the first time and they faint.
Just pass out.
Again, all of that are not actually worrisome things, but they are ones that might cause syncope.
But let's talk about the most benign and common causes of syncope. So number one, we already referenced vasovagal syncope, which is common fainting.
Yeah, and that's like a situational syncope. Often, that's actually the one we get with when they're taking blood or when they see blood or when they get scared all of a sudden.
And it accounts for 50% or more of cases presented to the emergency department of
and
fainting.
More than, and not in our office.
Absolutely, right, yes.
Yes. Typical clinical features are a precipitating event, so something that happened, followed by this prodrome, which usually means it feels like something's going to happen.
Like lightheaded, dizzy, sweaty, tunnel vision, nausea.
Like sweatiness, like
Yes,
yeah,
you just feel hot and bothered.
And the treatment, lie down.
Yes. We always remind teenagers when they feel this way, please, your body is yelling at you, go to ground, go to ground. So please do it before you do it without choosing it, which is so much more stressful to everyone else around.
Yeah, and if you listen to the warning, they won't actually fall down and hurt themselves or give themselves a concussion or cut something or anything like that. So it is really good. And I do feel like this is a common thing we see around any type. Like one of the most common times I see it is actually we give vaccines around 11, right? And often you give 3 at a time. And remarkably, kids come in and they're late and they haven't eaten and they haven't drank anything. And then they get their vaccine and they
just pass out.
Pass out, right?
Yes.
And it's not dangerous. Like, that's the thing about it. There was nothing like inherent in the vaccines or anything else. It's because our body was not prepared for
it physically or emotionally.
And often physically, because they didn't eat or drink anything. Like, they were already set up to do these things. So that's the other part that I talk a lot about, is that it is so important. And I know we just said this a bunch with the cardiac stuff: hydration, right?
Yes.
Eating small amounts of food frequently. Don't come to your doctor's office without having eaten or drunk anything, especially when you're going to have like things that happen where we're going to talk about things that may make them a little bit uncomfortable.
Yeah, how many teenage girls that come in for an appointment and their blood pressure will be the same as a 5-year-old, because blood pressure is related to height. And I'm like, the blood has to go a lot further from your feet to your head than it does a 5-year-old. So of course you're going to pass out, right?
Exactly. And especially if you like haven't done any of those things. So anyway, that's our big thing, is that these are things that can be avoided really easily. You just have to think about them. I actually now have Gatorade, water, apple juice, and crackers in my office, particularly. And I ask before 11-year-olds get their vaccines, have you eaten and drinking anything today? Because if you haven't, I have some.
Here's
Let's do that.
Snacks. Yes. So breath holding spells is another cause of fainting, and it's usually younger kids, right? 6 months to 24 months of age, and it's triggered by an emotional insult, which a lot of times at a 2-year-old is saying no.
But it can be like pain, anger, fear. Pain is a common one. Like my daughter had these, and her first one was because she was sitting in that chair, leaning back, as I told her not to 100 times, and it fell, right? And she actually, she fell with it, and it was really just more of a scary thing. She didn't even hit her head. Like, there was nothing, but she got really scared. And as soon as she started crying, and then all of a sudden she stopped breathing and even had something that looked like a little seizure.
Yeah.
And that was actually her first breath holding spell. And it was terrifying.
It is terrifying as a parent. Like, your kid little toddler just passed out.
That's right. It was absolutely terrifying. And I knew that that's what it was. And I was still terrified. I still took her to the ER. Yeah. Like, I still made my husband, who was working in the ER that day, take a look at her. Like, all of it.
And it's better to be that way, right?
Yes.
To be cautious. So they can either, in these breath holding spells, they can either just turn blue, which is really terrifying, and then they pass out. Or the worst one is they look really, really white, and then they kind of twitch a little bit, and then they pass out.
Yeah. But brief posturing, tonic motor activity that can kind of look like a little seizure can occur with these episodes, and often does. And that's where it can be really scary.
Yes. And this is often associated with iron deficiency anemia. So if your child is having breath holding spells, talk to your doctor, see your doctor to get their hemoglobin checked.
Yeah, especially if they're having them frequently. Like, usually, like, for most kids, it starts between about 6 months to,
like, I feel like nine to 12 months, like, when they start to be a little bit more mobile.
And then it stops by about age 6. But the hard part about it is that at that age, it's hard often to like figure out exactly what's happening. And so we really want to have it, you do want to have it go checked out with your doctor and make sure.
So another cause of fainting is orthostatic hypotension, which means your blood pressure goes down when you stand up. And this is usually related to like volume depletion, like dehydration, maybe anemia, or even some medications that can affect blood pressure.
And again, that volume depletion sometimes means too, they're not eating very well. Like, they haven't eaten anything that day, that type of thing. It's really common after big growth spurts that happen during puberty. And so this, again, is one of those ones we see in teenagers.
And POTS, it's become kind of a popular thing to be investigated, I think, because of social media exposure, and that's postural tachycardia syndrome. And it looks very similar to orthostatic hypotension. It's that when you stand up, you get dizzy and almost pass out. But the difference is that POTS is your heart rate goes up, but your blood pressure does not change.
So you don't actually get the dropped out blood pressure that you do with your orthostatic hypotension.
And so you have an increase of heart rate, usually about 50 beats or 40 beats per minute over your baseline for children and adolescents.
But the reality is that POTS is a pretty common disorder among teenage girls and typically manifests itself as palpitations, anxiety, dizziness, and shaking. syncope, that fainting, can occur in about 40% of patients, and the majority of people will outgrow this condition. However, one of the things, again, you can help with is, I think we're going to say it again, hydration.
Hydration, rest,
Eating regularly. All of those things are super important for all of these events. The other thing about postural tachycardia syndrome is there did seem to be an increase in after certain illnesses, like particularly prolonged viral illnesses, again, where they likely get a little dehydrated, start not to feel well, don't want to eat a bunch. Like all of those things are kind of working together to make like to kind of start
storm.
this off. Yeah. And those kids, for some reason, it just lasts a little longer. They don't recover quite as well with them.
And what can happen sometimes as part of this stress of feeling like you're going to pass out is that you'll start to hyperventilate, right?
Oh, yeah.
You're like, oh my gosh, I'm going to pass out. Start to breathe faster, breathe faster. And then you get some chest pain, some chest tightness, shortness of breath, and then you're more anxious about it.
Yep. And then you pass out.
And then you pass out. And, one of the things that helps us figure out hyperventilation by story, if we're not witnessing it, is if they felt some numbness in their hands or face, then you're like, oh, you weren't getting oxygen to those places. You were hyperventilating.
Yeah, this is like the teenage version of breath holding spells.
Yes.
But the good thing about hyperventilation is like you can stop it.
Right. In the old school, blow in the brown paper bag, right? What that does is focus your brain into doing something so you stop breathing so fast.
And you start breathing more calmly and slowly. And that actually is what stops hyperventilation. It's not that they're getting some weird carbon dioxide stuff. It's actually just the point of breathing out, focusing, breathing slowly. So,
yeah. And so hypoglycemia is often blamed as a form of pre-syncope
fainting
or a syncope, but it's actually super rare unless you're insulin-dependent diabetic.
Yeah. It is really an uncommon cause of syncope. A lot of times people want to check it, and that's okay. But it is very, very rarely a part of actual fainting with it, unless you have diabetes.
Because when your blood sugar gets low, you get grumpy and weak and sweaty
and
kind of mean and irritable. And then you might go into like agitation and confusion, and then you might faint, but usually someone's intervened in the irritable, hangry stage and the agitation stage.
That's right. So as we hinted out earlier, prevention for most causes of syncope in kids is what exactly we talked about. Drink a lot of water, get enough rest, make sure you're eating food on a regular schedule
Real food
throughout the day, not a Red Bull.
No, that's not going to help you stop fainting and it's going to make your chest pain more likely to happen. So.
Also work on those anxiety decreasing skills we talked about in previous episodes. But there are some red flags for syncope that we really do want you to pay attention to.
And some of the red flags for syncope are the things we talked about earlier with chest pain related to cardiac condition or events, right? That's like the chest pain or dizziness or passing out related to exercise. Those are your real concerning red flags.
And one of the big ones is kind of coming up in the summertime, which is heat illness. Really hot outside today. And heat syncope is a real thing. It is exercise-associated collapse. And it occurs when an athlete is unable to stand or walk due to lightheadedness or syncope. This form of syncope usually occurs immediately after completing like a race or a workout, and is commonly seen like in those like really exercise or like sports that are doing those things, long distance running,
2-a-days
football,
for your soccer, your football, right?
Like where you're basically in a lot of stuff and you're like in the heat of the day running or exercising.
And these kids are usually like a little bit confused or altered mental status, really irritable before they pass out. And you're like, that is not right. Something is not right.
Yeah. And it can lead to things like seizures and even coma. So it is a really big thing to remember. And that actually requires what we already discussed, hydration.
Prehydration.
But prehydration is so important for those events. And then really trying to not be out in the heat of the day doing those really intense exercising.
Yes. And as we discussed in our summer podcast last year, treatment is slow and steady cooling and hydration, right? You can't chug a bunch of water if you've almost passed out.
And go into air conditioning.
Yes.
Anaphylaxis can also involve syncope and loss of consciousness. Anaphylaxis is basically a life-threatening allergic event where you can your blood pressure drops. You are really sick from an allergy type event.
Body shuts down.
Yeah.
And sometimes, especially if anaphylaxis happens in a situation someone is already hot or exercising, so they're already kind of feeling flushed and they're itching, maybe they're having a harder time breathing, you kind of miss those subtle symptoms before they actually
Like
pass out. Hives, right? And so this was a patient when we were in Indiana that was someone that was running one of those color dye races, where they wear the white shirts and people throw paint at them. And at
Which
the
seems
end,
like it wouldn't be fun anyway.
no,
but-
it seems terrible. But, these teenage girls love it. And so she was running this race, and at the end she collapsed, and everyone just assumed she was just exhausted from running, but she actually had anaphylaxis because she was allergic to the dye.
Yeah.
And it had been covered in it while she was running.
And the hard thing about that is the treatment is emergent. It is epinephrine. And so sometimes if they know they have that allergy, like you can have the access to
EpiPen,
that
yeah.
right away, but you might not in other situations. So call 911, get help immediately if you see really that like passing out and they have hives or other things that make you think like, hey, this is an allergy.
There. And we talked a little about cardiac events, but arrhythmia is one of those that you don't necessarily have to have family history of. It just shows up, and all of a sudden, heart rate is really high, and they're feeling lightheaded, and then again, chest pain and dizziness during activity.
And it can be a cause of not just syncope, but sudden death. Like this is actually your hypertrophic cardiomyopathy and those types of
Long QT.
long QT that are really heart issues that kind of present in that situation, and often are an event of real syncope and not their heart is not functioning normally.
So again, for kids, it's always important for medical providers to ask about family history. And this means for families, tell us your family history. If there's any episodes of sudden death or collapse in any of your family members, we need to know.
That's right. And so this is actually one of the things we screen for in sports physicals.
This is why we do sports physicals.
This is why we do sports physicals, truthfully. But often they have no sign of this ahead of time. So it's truly a family history knowledge thing. So when they ask and they're like, hey, have you ever had a family member die of sudden death? That's what they're talking about. And so if your child is coming to their sports physical by themselves, tell them that happened.
Right.
Don't let them just say no to everything.
Yes, 'cause we need to know. And if you ever see a child or teen pass out during exercise, call 911 and look for an AED.
That's right. And it may be an overreaction, but it is better to be aggressive and be there and put that AED on and know that there's something happening that you can actually fix right away. Because the earlier that we do that for these cardiac episodes, the more likely we are to save that person's life. There are AEDs now in most spaces. Like if all of our schools and gyms, there will be an AED nearby. Most of the fields, they have an AED nearby, usually at the schools. So there are ways to find that. You just need to get there.
And I'm a big fan. If you go to a new place, you go to a travel sport game, just look around and see where it is. You might be the person that needs to find it because no one else there might know where it is.
And yes, most of the time they are saving adults at those things.
But still, we want to save adults too.
We do. Anybody, it is good. And sometimes it'll save the child that's participating in it.
So we hope this helps you feel more comfortable about chest pain and fainting, realizing that for most kids, it's not a serious event, but for the ones that have some red flags, please see your provider.
We hope this information helps you keep your child and athlete happy, healthy, and safe.
This is Dr. Joanne Smith.
And this is Dr. Corinna Hankins.
Thank you for listening.